Welcome to Family Health Today, Arkansas's only weekly in-depth look at the medical and health issues affecting you and your family. Brought to you by Jones Television, in cooperation with our sponsors, Northwest Arkansas Newspapers, LLC.
Welcome to another edition of Family Health Today. I'm Dr. Jeanette Neshwat. Today's show is taking a different format to explore an exciting topic. All of us want healthy children, and even though most children grow up strong, healthy, and happy, our nation continues to see a rise in the rates of asthma, autism, diabetes, premature birth, and birth defects, as well as other health problems. Well, the good news is that healthcare providers here in Northwest Arkansas are working with the National Children's Study to learn more about how things in our environment and our homes affect children's health. Currently with us today is Dr. Hobbs, who is a professor of pediatrics with the College of Medicine at the University of Arkansas, and she is also the director of the Arkansas Reproductive Health Monitoring System and the section chief for the Center for Birth Defects and Research, where she has been principal investigator for birth defects genomics laboratory at the Arkansas Children's Research Institute. She also serves as the principal investigator for the National Children's Study. And also with me is Dr. Nadine Ford, an obstetrician gynecologist in private practice at Pinnacle Women's Health in Rogers. She completed residency training in obstetrics and gynecology at Louisiana State University Medical Center in New Orleans. And after residency, Dr. Ford remained on faculty at LSU for 3 years and has been in private practice since. Dr. Ford is also a member of the board of directors for the Ozark affiliate of Susan G. Komen for the Cure. And we also have a wonderful audience today. Thank you for being here with us. We appreciate that. Dr. Hobbs, let's start off by telling us what exactly is this National Children's Study?
The National Children's Study is the largest study of children's health in the United States that has ever been conducted. In the National Children's Study, we will be looking at how effects of the environment and how our biology affects our growth and development.
And what do you mean when you say environment? What do you mean by that?
Well, environment can be, what I mean is it is very broad in scope. It can be the things that anything that we are exposed to and during our daily lives. So we are looking at the family environment and the community environment in which children are born and in which they then grow up.
And how is Benton County involved? That's really exciting. The only county in the entire state of Arkansas.
It's very exciting that Benton County is involved. And Benton County was selected randomly among the 3,100 counties that exist in the United States. It was kind of like putting all the names in a hat, and then Benton County came up. So we are very excited to have this opportunity.
Very lucky. Dr. Ford, tell us, what is the criteria that women must meet to become a part of this program?
Well, women who are interested in participating in the National Children's Study must be between the ages of 18 and 49 and either pregnant or planning to become pregnant. And they must live in one of 14 predetermined segments in Benton County.
And how are women, how are they recruited for this study? What is the process?
The recruitment during this phase of our study, which is the initial phase of the study or the pilot phase of the study, the recruitment method that we are using in Benton County is through healthcare providers who care for women who are planning to become pregnant but not yet pregnant or are currently pregnant. And so it is like clinics such as Dr. Ford's that will help us to recruit these women.
And tell us why this form of recruitment is chosen, Dr. Ford.
Well, it's been pretty well established that women really trust their physicians when it comes to their reproductive health and planning a family. So we're very excited that this method has been chosen. It's very easy to integrate that conversation about the study into the conversation that we have with our patients who are planning pregnancy.
And as an OBGYN physician, what are your thoughts about this entire program and study that's going on?
We're very excited, and we're very excited to be for the opportunity to participate in the study and to have our patients be enrolled. I think that the information that will come from the study will be invaluable. The scope of the study is broad. The outcomes that it's looking at are varied, as well as the exposures that are being measured. So it's really exciting and such a great opportunity for us to be a part of it.
All right, very good. So let's talk about numbers. How many women have been enrolled so far, and how many are you looking for?
In this part of the study, that is the pilot phase of the study, we have enrolled 30 women, and we have just started enrollment within the last 2 months. Our goal for the pilot phase of the study is 100 women. We hope to begin the main part of the study in January 2012, and then we hope to enroll 1,000 women and their newborn babies, and the babies will be followed until they're 21 years of age.
Wow, so that's a large number. Dr. Ford, tell us when a woman comes to see you, how does it work? Do you start talking to her about this program? Tell us about the process.
We do. Actually, when the patient comes into the office, she is kind of evaluated and screened to see if she meets criteria. So those patients are kind of identified to us already. And the conversation that I have with the patient is to let them know, to share with them our excitement about being a part of the study, let them know that it is a national study. I also let them know that it's an observational study, meaning that there's nothing experimental that they would have to take. It's just really asking for the opportunity to follow them and look at what they do and what they're exposed to daily, and then look down the line at the outcome, the effect that may have on outcomes.
I see. So after you speak to them, what happens after that, Dr. Hobbs?
After someone like Dr. Ford or her colleagues would speak to the woman, then one of our staff in our National Children's Study office here in Benton County would ask the woman some more questions, but also answer questions that she may have about the National Children's Study. At that point, if the woman is interested in participating in the study, then we tell her all about the study and we obtain informed consent. All of the participants have to be give us informed consent in order to be able to be enrolled in the study.
Now, I understand that there's lots of questionnaires and interviews beforehand, but do you actually go out to their environment and test the water and the soil and the air and that sort of thing? Is that correct?
That's what we will hope to do in very shortly. At this point in the pilot study, we have just been completing interviews. In a very short period of time, we will start to collect biological samples, including blood, placenta, meconium, and we'll also collect cord blood from the baby. And then it will be very important that we look at the environment and include samples such as dust and water and paint samples.
Very good.
A woman, once she is enrolled in the study, she may at any time choose to opt out of a particular part of the study. So if she wanted to, for example, participate in all of the study but not have her soil taken for samples, then she could opt out of that part.
Really? Okay, very good. What kind of information do you hope to obtain at the end of 21 years? Or is data going to be formulated and information going to be gathered throughout the 21 years?
Yes.
Or is it at the very end?
We will be collecting information and gathering data from the beginning, and there are already writing teams that are set up on a national level to begin to look at the data that we collect as quickly as we can so that we can provide that kind of information back to families and their communities.
Very good. Stay tuned, Family Health Today. We'll be back in just a moment with more questions.
I'm Rick Schaefer with Champions for Kids. Join us at Reynolds Razorback Stadium for Abbott Nutrition Razor Fest on Saturday, April 16th. There'll be games, giveaways, live entertainment, celebrities, and former Razorbacks. It's all free at the Abbott Nutrition Razor Fest from 10 a.m. to 2 p.m. The activities lead right up to the Red-White Razorback football game. It's the 4th year for Coach Bobby Petrino. Join us for Abbott Nutrition Razor Fest, April 16th.
There's a popular expression, "not in my backyard." This expression refers to the idea that none of us wants anything bad in our own immediate environment. In Northwest Arkansas, we all share a pretty big backyard. One of the outstanding features of our backyard is Beaver Lake. Beaver Lake not only provides beauty and recreation, but our lake's water is the lifeblood of our region's economy, growth, and quality of life. It's very important that we all take proper care of our backyard. Disposal of toxic substances such as used motor oil and household chemicals has a direct impact on the quality of Beaver Lake. Your backyard, my backyard, our backyard in Northwest Arkansas is Beaver Lake. Visit the Beaver Water District's website at bwdh2o.org for information on what the lake and its watershed means to us all. Beaver Lake, you drink it every day.
Open Avenues, formerly known as the Adult Development Center of Benton County, is a training organization for people with disabilities. We prepare our clients to become a part of, rather than apart from, the community. We provide job skills training and placement services. We offer instruction in life skills and opportunities for socialization. The Open Avenues culture demands our services be excellent and our clients successful. For more information, call 479-636-5082 or visit openavenues.org.
We have some questions from the audience. Irsima?
Yes, I'm very interested in the study and am planning a pregnancy. My concern is how will my baby's confidentiality and privacy be protected?
Aracima, that's an excellent question. And one of the things that we have to do is we have to ensure confidentiality. All of your personal identifying information will be encrypted, and any samples that are taken from your home or your environment also will be just identified through an encrypted identification number. If at any point there is any concern about your samples, you can of course call the office, but we have been conducting studies like this for several years, and ensuring the confidentiality of participants is of paramount importance to us.
Anthony, looks like you have a question for us.
Hello, doctors. My wife and I recently moved to Benton County, and we're actually in the process of selecting a doctor because we plan on. Yeah, exactly. We plan to become pregnant in the near future. My question for you, Dr. Ford, is if we were to stop by Pinnacle Women's Clinic and to discuss the National Children's Study, what 3 things would you tell us that might convince us that it would be worth our time investment?
Well, Anthony, I think the first thing that I would share with you and let you know is that, well, this study really contributes to the greater good. And in saying that, I mean that the information that will be collected and the data that we collect and what that tells us about how environmental exposures and biology and so many different variables affect your child will help your children, your grandchildren, and generations to come. So that would be the first thing that I would let you know. The second thing I would let you know is to again stress that there's really nothing different that you have to do other than allow information to be collected about what you do, where you live, what exposures you're subjected to. So there's no experimental component in that you're taking an experimental drug or anything that you may be concerned may be harmful to you. And the last thing I would let you know is that the information is confidential. Your privacy would be protected.
Okay. Very good.
Great, thank you.
All right. Rosie, did you have a question, dear?
Hi there. Well, I'm a nurse, and I'm really interested in the study. I think it's great. I do have a concern about exactly, I know the study is 21 years, and so how are you going to follow women for 21 years, and how many times are you actually going to be in, visiting with the participants?
Very good question.
That is a really excellent question. And initially, at the beginning part of the study, when the woman is pregnant, we will be visiting her about 3 times, a maximum of 3 times. There will be a birth visit, and then during the first year of life, when so many things can occur during infancy, we're planning about 2 to 3 visits. As the child grows, with each subsequent year, there will be less visits. We know that the period of rapid growth is from the neonate really until the child begins school. So during that time, there are more intensive visits. Your second question about retention that is our ability to be able to follow the participants over 21 years of life. That is being addressed at a national level by many people thinking with a lot of creativity about ways to encourage participants to continue to be involved in the National Children's Study. We are going to be looking at different methods of incentives based on a child's particular time of development and what might be interesting to them. So, for example, for a 3-year-old, the parents' interests and the child's interests are going to be very different than when that child may be 15. And the contribution, but also the incentives that will be used for them will be different depending on their developmental stage.
Thank you.
Sherry, we have another question from Sherry, who's from Benton County.
Yes, I do live in Benton County. However, my children are grown, so I don't plan on having any more children. But I just wonder, in a time where the economy is so bad and we hear about budget cuts, how is this study funded, and am I going to see an increase in my taxes due to the fact that this study is now in Benton County?
Well, again, another question that I think is of great importance to all of us as we watch the economy at this time. The study came about as a result of the Children's Health Act that was passed in 2000. The study has been in existence across different administrations, and the funding comes through the National Institutes of Health. We believe that this study and have had good evidence that the study is supported on a bipartisan level, and we do not at this point think that the study will entail more costs that you would see that would help, that would in any way change your day-to-day life.
Will it change healthcare costs? I mean, how will that affect maybe healthcare costs that...
No, it should have no impact on healthcare costs. As been said before today, it's an observational and volunteer study. So really we expect that you can, or the people that are involved in the study will just live their lives and be able to make changes to the health of future generations by just living their lives.
Thank you.
Very good. All right, Trace has a question for us.
I was just wondering why a couple might want to become involved in this study. Really, what would be in it for me?
Well, there is a minimum amount of compensation up to about $100 in gift cards. You do receive an additional ultrasound at no cost to you. And there also are some other small gifts like books or music, CDs, things like that.
Oh, right. Okay. And Dr. Ford, I know you mentioned earlier about the whole process. How many, may I ask, how many people from your clinic have actually signed up for, do you have any idea, or would you know, Dr. Hobbs?
Dr. Ford's clinic was the first clinic to begin enrolling women, and we have continued to enroll women from her clinic, and we're just delighted to be able to do so. I don't have the exact numbers.
I believe it's 17.
That's a pretty decent number. Now, do you foresee having to turn anyone away?
At this point, we do not see that. We will complete the pilot study, and when we get to 100, then we will stop. But no, we don't see having to turn people away.
Is there the website? Tell us about this website that someone can go for more information, Dr. Hobbs.
Well, there is a website that is set up on a national basis. I will stress again that there are 37 sites that are currently involved in the study, and the hope is that there will be 105 counties involved once the main study begins. So there is a national website, and it is the National Children's Study website.
nationalchildrensstudy.gov /HCHRI.
Right.
And do you know, this is a national study here in America, do you foresee it extending to other countries?
There are multiple other countries now, especially European countries, that have had longitudinal child health studies. There are some in, certainly Denver has one, Norway has one, and Britain is just about to start a second national health study. We really think that although we can gain important information from the European studies, we think that there are enough unique exposures and unique ways of life here in contrast to Europe that we really need to be able to ask about American children.
Sure, absolutely. Very good. And there's also a phone number that one can call, 1-877-KIDS-STUDY, for more information. Can people get information over the phone from calling this phone number and finding out, you know, are they qualified? Do they meet all the criteria and that sort of thing?
Absolutely, that information is available to anyone who's interested.
Okay. Do you have any advice, Dr. Ford, for someone that's thinking about it or is unsure?
You know, I would just encourage them to really strongly consider participating in this study. And I think that, you know, sometimes when we say research study, that people are apprehensive and they wonder, you know, somehow they're being experimented upon.
Right.
But it's really such a wonderful opportunity to, as Dr. Hobbs said, just live your life and allow someone to take a few snapshots along the way and gain really important information.
Do you expect to see a decrease in premature birth and birth defects years from now because of this study?
We are very hopeful that the information that's gathered in this study will make a difference in so many different things in years to come.
Very good. Looks like we have another question from the audience.
Yes, I have another question. How are you planning on addressing the language and cultural differences for Latinos?
Well, that's a great question, and actually there are translators that are available to enroll patients in this study, so that resource is there for the patient. Also, all of the consent forms are in English and in Spanish, so that if there is a language barrier, we have those resources to address that.
Thank you.
All right, and we have a curious crowd today. One more question.
Thank you. Both of my siblings have a child with autism, and I know how costly it can be not only to their families but also to the state. Do you think that some of the findings for the studies will not only allow for better health but to help have some economic savings?
We certainly hope so. As we know, there are many childhood conditions that really result in a lot of medical care costs, such as autism, prematurity, and birth defects are just some examples. We hope that the information that we gain through this observational study will allow us to identify new factors that can be used to prevent some of these conditions from happening. So, for example, if we look at autism and the costs, if we learn that there are particular exposures or particular biological factors that can be modified such that we could prevent some of those conditions from happening, then that could result in an enormous cost savings. And we hope that that will be true for each of the conditions we study.
And Dr. Hobbs, is our health department involved here in Northwest Arkansas with this study? What is their involvement and role?
So their involvement entails both helping us in terms of being advocates for the National Children's Study here in Benton County, and then for the occasional time where they may provide obstetrical care as well, they will be another avenue by which we can identify participants that can be enrolled in the study. And so we think that it is important to have multiple different supporters throughout the community. This is really an opportunity for Benton County residents and community entities to really gather together towards helping the future of our children and future generations to really improve health. We know a lot about adult health, but we know substantially less about children's health, and we need to begin to really address the questions and then to come up with answers and solutions.
Absolutely. In a sense, it's a long-term investment to find out answers now. What if someone is enrolled in this program and the child is born and then up until age 6 years old, they move, their parents move? Does that mean they're out of the program, or can they continue it elsewhere?
They can continue it elsewhere. So if they were to move from Benton County to another county in which the National Children's Study has a site, then they can continue the study from that new site. We also think that if they move to an area of the country where there is not a National Children's site, that there may be the possibility that we will continue to follow them from a distance.
Okay, and just to clarify, Dr. Ford, a woman can present to you and may or may not be pregnant. She can still participate in the program.
That's correct.
If she chooses
That's
to.
correct. If
So she
she's
doesn't
planning pregnancy.
Oh, if she's planning, and she can change her mind at any time. It's
That's
very,
correct.
very flexible, a lot of freedom. They're
Absolutely.
not tied down. There's no contracts to sign or anything like that.
No, that's
okay.
right.
And we have another question from the audience. Go ahead, Amy.
I was wondering, how has past research impacted women's and children's health?
That's a very long response for that question, but let me give you an example, and one that you may have heard about recently, and that is folic acid. So it was through observational studies and that we began to understand the role of folic acid and the importance of folic acid in the health of pregnant women and their offspring. And it was through studies that were conducted in a similar fashion to the National Children's Study that we learned that if a woman takes a supplement, a vitamin basically, with folic acid in it, that she can prevent some of the adverse pregnancy outcomes. For example, there are some birth defects that can be prevented simply by a woman taking folic acid prior to her birth. And I know Dr. Ford has a lot of clinical experience with that as well.
That's right, and you know, more valuable information that extended beyond the initial information about decreasing birth defects is that we've kind of changed our recommendation. It's evolved from taking a vitamin with folic acid during your pregnancy to starting 3 months prior, because we found that to be more beneficial. And now the recommendation is actually that you start 1 year prior to conceiving, and that's also been shown to decrease a woman's risk of preterm delivery. So it's very important and very vital information that definitely affects outcome and saves lives and money.
Absolutely. Well, we're so fortunate today to have Dr. Pete Kohler, Vice Chancellor of UAMS. Dr. Kohler, just how is this going to impact AHEC and UAMS?
Well, we're very enthusiastic about participating as much as we can with the study because it does relate, I think, to the overall health care in the area, and I agree with everything that's been said about how important this is to Benton County and to Arkansas. I think about the Framingham study that has been done on adults for many years, and a lot of information has been forthcoming from that that's been useful. I'm very hopeful that this will do the same thing for children. I've seen estimates as high as in excess of $90 million per year being saved if, in fact, the information from this study can be applied early to prevent some of these conditions we've been talking about.
Very good. Excellent information. Well, thank you to all of our guests and our audience for being here today. We appreciate it. Please join us next time for Arkansas's only weekly medical journal. I'm Dr. Jeanette Neshwat. Thank you very much.